Hello, my name is Matt DeFrega. I am an evaluator with the Department of Health and Human Services Office of Inspector General. Our mission is to protect the integrity of HHS programs as well as the health and welfare of their beneficiaries. Today, I will be presenting on the topic of community roles in emergency planning. As we have certainly seen over the last year with COVID-19, any emergency, be it a hurricane, infectious disease, or active shooter, can result in catastrophic consequences. These events are often unexpected with little time, if any, to adequately prepare. That is why it is so important to dedicate time up front for effective emergency planning before a disaster occurs. For many years, HHS's Office of Inspector General, or OIG, has been studying and reporting on emergency preparedness and response, including responses to emergent infectious disease outbreaks like Ebola, natural disasters such as Superstorm Sandy, and other situations that required emergency-style rapid attention, such as when healthcare.gov did not function as intended upon its launch. Through this work, we've explored the roles in emergencies of communities, and in the video, we will give you key considerations from our findings as you and your organization explore emergency preparedness. For more information on how to develop an emergency plan and lessons learned about emergency response, refer to OIG's companion video, CMS Emergency Preparedness Rules and COVID Response. Communities play a key role in emergency planning and response. In studies conducted prior to the COVID-19 pandemic, OIG gained insight in several areas. First, providing clear guidance, flexibility, and appropriate oversight are important when distributing emergency funds to local entities. Careful and clear management of response and recovery funds provides local entities the clarity they need on how funds may be used, when funding sources expire, and what documents or other evidence must be maintained for program integrity purposes. It's also helpful at the community level to establish flexible use of funds to support them in addressing community-specific needs. With this flexibility, there is federal and state oversight to ensure that recipients use funds timely, submit required financial status reports, do not draw down cash advances in excess of immediate needs, and do not claim expenditures that were reimbursed by other sources. Second, prioritizing all hazards training of community organizations, staff, and volunteers is key. One strategy for consideration is hands-on training for volunteers to supplement any available computer-based training. Here, the timeliness of training is critical, reaching emergency response volunteers or others assisting in response efforts before they are deployed. Under the Hospital Preparedness Program, which supports the creation of healthcare coalitions, awardees must coordinate the identification, recruitment, ongoing training, including drills and exercises, and engagement with volunteers to ensure an effective and coordinated response to an incident in the healthcare coalition's jurisdiction. For community training, tailoring the training based on specific community needs is important. Also important is ensuring broad participation in any exercises or drills, including, for example, childcare facilities and non-hospital facilities such as nursing homes. In the case of public health emergencies, enhanced laboratory capabilities may be needed, starting with coordination and communication among public and private labs to rapidly expand testing capacity. It is helpful to coordinate among private clinical laboratories and state public health laboratories to decrease the time needed to detect and report outbreaks. Additionally, timely information sharing about test results from state public health labs to healthcare professionals helps to support and activate an effective community response. As evident from the recent COVID-19 outbreak, it can be challenging to predict testing capacity needed in an emergency situation. However, to be prepared for an outbreak, consider implementing operational plans and preparedness exercises to augment laboratory capacity to meet increased testing needs during a pandemic. Vaccination programs may also be required for community-level emergency response. These programs should account for vaccination distribution and dispensing plans, facilities to serve as dispensing sites, sources that will be necessary to hire and support distribution and dispensing, individuals who should be authorized to receive medications, and specific plans to dispense vaccines to vulnerable populations and priority groups. As with other components of the plan, Once the vaccination plans have been established, it is helpful to develop exercises to test them. Last, but not least, in times of an outbreak, the general public should be provided clear, accurate, and consistent information about vaccines, including the dosage needed and any potential adverse reactions. Testing and communication are key components of an all-hazards approach to emergency preparedness. You can learn more in our companion video from this series, CMS Emergency Preparedness Rules and COVID Response. A community-based emergency response plan also considers the management and distribution of medical equipment and supplies, including storage space and equipment requirements, maintaining and replacing equipment, and logistics of transporting the equipment when needed. As we have learned during the COVID pandemic, another key component is consideration of need for alternate care sites such as temporary hospital sites, the scope of care they will provide, and their staffing. Our final topic related to community-level emergency response is emergency preparedness planning, including the potential to leverage community healthcare coalitions, referred to as HCCs. HCCs are groups of local healthcare and response organizations, such as long-term care facilities and home health agencies, in addition to hospitals, public health agencies, social service agencies, emergency medical services, and emergency management, working together to prepare for and respond to disasters and emergencies. Regardless of whether a formal healthcare coalition already exists in your area, it is important for each community to involve a broad array of organizations in emergency planning efforts. An all-hazards approach to emergency planning can be especially helpful, and this topic is explored in more detail in OIG's companion video, CMS Emergency Preparedness Rules and COVID Response. Please also be sure to watch our companion video, OIG Studies on Ebola and COVID-19 Experience, to learn about the results from 2 recent case studies that highlight actions taken to enhance emergency response and shed light on remaining opportunities for future improvement. Emergencies are often unexpected, arising with little or no warning. Strong emergency preparedness, including planning and coordination at the community level, helps mitigate catastrophic consequences and also steers you away from committing fraud, waste, or abuse with federal dollars.